Yeah, hello, good evening, everyone. I remain Adil Latunde Michael. This evening, we have come again on another course, which is an introduction to immunology. This introduction to immunology will actually expose us to a lot of things. That is the scientific study of the immune system. So, what do we mean by immune system? What are the ways of protecting our body from the external aggression, which could be from a microorganism and so on and so forth? Honestly speaking, if not because of the immune system that is naturally being put forward, uh, the way we expose ourselves to a lot of things, our body immune system or our body will have been overwhelmed. So, immunology is just the scientific study of protection from microorganisms. So, we are going to see this. We are going to look at the principles, the history, the types, case studies in so many cases, and this is how we are going to continue in the next. Then after that, we will look at two or three quizzes that later on you have to submit immediately after the lecture, and you just like your normal way of doing it, so you submit immediately. Okay. Now, immunology, just like I said, is the study of the immune system and how the body is able to defend itself against harmful agents. What are these harmful agents? These are microorganisms, these are pathogens, these are disease causing organisms. So, how our body is able to defend that, and the mechanism of defending the immune system is exactly what immunology is all about. So we are going to see that in this. So in this lecture is going to talk a lot about the definition, certain definition. We will look at some key terms and terminologies in immunology. For example, we'll look at what is an antigen, what is an antibody, what do we mean by immune system, a lot of classical pathway and so on and so forth. We will look at that. Then we will look at the history. How did we come about immunology? We look about history. We look at fascination. Then we will now look at what are the branches of immunology, the scope, and will give us round it up with examples of immunology. Okay, immunology is a branch of biomedical, that is biology combined with medicine. So it's a branch of biomedical science which is the study of the immune system, how it functions, the disorder, that is disorderliness and defenses. So if we are talking about immunology, we are going to base it on four key things. Number one, we look at the holistic approach of the immune system. We look at the immune system as a whole. What are the so we look at the innate immune system, we look at the humoral immune system, and we look at a classical immune system. So then the function of the immune system and the components of the immune system, what are their functions? If you talk about a classical, what are the function of the component of a classical immune system? Then disorders. So we'll still come to a point whereby we will be looking at when the immune system tend to overreact, or when the immune system tend to lose its control, just like if you are driving a car and the car loses control. So what are going to be the resultant effects? So that is what is going to talk about. We are going to look at when we'll be talking about the immune disorder, that is autoimmune diseases. And then we will also look at different types of defense mechanism. We will look at it. So how is the body? For example, if you have a bacterial infection, what are the machinery that will be put in place by our body to make sure that it survive the assault, it survived the pressure. So I told us that if not because of the competence of our immune system, we will just our body system will have just been overwhelmed by a lot of factors, by pathogens, that is by diseases, by disease causing organism. So then example is we will also look at vaccine. How do vaccine come into play in protecting the immune system or in helping, in guiding against infection for us? So studying how vaccine train the immune system, we'll look at that. What are the basic terminologies in immunology? The first one that we must look at is antigen. Antigen is a substance that triggers an immune response. So if it is just a substance that does not trigger immune response, that means it cannot be regarded as an immune system. So any substance, could it be chemicals, could it be food, could it be nutrition, any substance at all which must be foreign that triggers an immune system is what is called an antigen. Then antibody, these are protein that are made by immune system in order to be able to fight against infection, in order to be able to fight against infection. Okay. Now, uh, antigen, just like I said, is always foreign. It's also foreign. It must be foreign. It must not be part of the body. It must be in antagonistic effect to the body. That's why we call it antigen. So it is foreign. Apart from being foreign, it must also be able to trigger an immune response. If it is foreign but it cannot bring out immune response, that means it cannot be regarded as a antigen. Then antibody, these are the proteins that are made by the immune system in order to be able to fight against antigen. So antibody are just that they are part of the system. These are secreted by our own body in order to be able to defend our body from external aggression, that is from antigen. Then pathogen, these are disease causing organisms, and categories of these include bacteria, it include fungi, it also include viruses. And a case study of this is a COVID-19 virus, which act as an antigen, and antibodies produced by vaccine. So vaccine is what COVID-19 vaccine is what is going to produce the antibody to be able to fight against the antigen that is produced by COVID-19. So each disease causing organism, each pathogen has its own way has its own way of attacking. They have their own weapon that they use in order to be able to attack our body. Okay. Then innate immune system, this is the first line of defense, which is non-specific. You have to know that. Innate means inborn. Innate means first line of defense. It is non-specific. We will look at this when we go on. And I want you to also consult my videos in both Omega Biodeterminants so that you'll be able to have more insights into immunology in particular. Okay. Then adaptive immune system. So innate immune system is just like they are like virgin, they are naive, they don't have prior experience. It is the first line of defense that is between age 1, age 0, and age 5. This is what is this is what we have when we are born with. This is the protective mechanism that we are born with. But adaptive, it has to be adapted. There must have been a prior experience, prior external aggression. So specific, which is very, very specific. So which we develop over time. It is long term before you will be able to see antibody being produced against it. It must learn. It must learn for a long time. So innate immune system is more specific, is quicker in response than in adaptive immune response. So we have to know that. Then immunity. What do we mean by immunity? Immunity is the ability of the body to fight against infection, to resist against infection, to prevent against infection. An example is the skin. Example of innate immune system is our skin. Measles vaccine as the adaptive defense. Okay. The basic principle of immunology include number one, ability to recognize self from non-self. So if the immune system cannot recognize part of the body from the one that are foreign, so that means the ability to wage war against the non-self will be impaired. So that means the immune system should be able to differentiate between self and non-self. Then immunity must be very, very specific in response. It must not be general. It must be certain. It must be specific. So that is number two principle of immunology. Then the ability to have good memory of the past is very, very important. Very, very important. So, and that is one of the characteristics or features of the adaptive immune system. For example, now, if the body, so for example, when you talk about adaptive immune system, so there are some of the antibodies or there are some of the immunological responses that are going to be used to fight against the enemy. Then, apart from that, part of it will now be stored in the memory of the cell so that in case there is a recall or reoccurrence of the first, the similar or the same kind of episode again, the body will be able to remember quickly and be able to fight it. So that is a memory of the past. Then tolerance to self antigen. So under normal circumstance, your body must be able to tolerate the all the cells that are made from your body. And that is what it is called auto that is a self, okay. Then history of immunology. This can be dated back to the ancient China when variolation was introduced for smallpox. That is when it started was when they discovered that if you pick somebody that is infected against smallpox and you now inject that smallpox into another person, the person will recover. So that was dated back as far back as in ancient China. And the first discovery was by Edward Jenner. That was 1796 when the first smallpox vaccine was developed. So when he injected his 5-year-old with cowpox with smallpox, and after 11 days, the child now recovered. That was the beginning of vaccination. So, and don't forget that we will look at it, but vaccine is a substance that is able or that is produced in order to be able to do what? To train our body to fight against the infection. So that is that. Then a case study of Edward Jenner, which used cowpox to protect against smallpox. So cowpox in cow, and he discovered that when he used cowpox uh, from that agent from the cow. So that also has the same ability to produce against the. So just like they say in Yoruba that you can only use madness to cure madness. So that is a cowpox. That was the beginning of fascination, and that was when Edward Jenner is still being regarded as the father of immunology up to today. Then this issue of immunology cannot be completed without the mention of Louis Pasteur in the germ theory, which developed rabies vaccine, and Robert Koch, which identified that there are some organisms that diseases are caused by microorganisms. So that was by Robert Koch. And a case study of Pasteur rabies vaccine, which saved a boy which was who was bitten by a rabid dog. Then the branches of immunology include clinical immunology, which is the study of immune-related diseases; immunogenetics, that is the role genetics play in immune function; then immunopathology, that is the study of immune disorders; then veterinary immunology, that is animal immune system. Okay, an example is HIV studies in clinical immunology. So this is a part of clinical immunology, that is the study of immune-related diseases. HIV is human immunosupplement virus. Okay, sorry, human immunodeficiency virus. That is when the immune system is deficient, when the immune system is under pressure. So when the immune system is already pressed down, is already overwhelmed. So there are some illnesses that's going to come up. So these are part of that's why we said clinical immunology is the study of immune-related diseases. So then the scope of immunology, number one, our ability for us to understand how disease can be prevented. That is number one. Then another thing is vaccine development. So vaccine development, and don't forget that nowadays we now use a lot of things to be able to understand what is vaccine development. We use bioinformatics tool to be able to design this and so on and so forth. So it's still part of using bioinformatics to design vaccine is another way of practicing the practical immunology. Okay, then allergy and autoimmune disease treatment. So that is still part of it. Allergy is when the system reacts to external substance. That is allergy, when you become allergic to allergic condition. And autoimmune disease treatment. Then organ transplant success is as a result. Blood transfusion is as a result of which is also part of immunology. So a case study is when you use of immunosuppressants in kidney transplant. So one before you do kidney transplant, that is, you want to transplant an organ from person A, an individual A, to individual B, and you don't want the individual immune system of B of A to fight against the organ from B. That means you now use some drugs that will now bring down, that will now prevent, and will now hold the defensive mechanism of A so as to be able to accept it, the organ from B. So that is the use of immunosuppressants in kidney transplant. Then what are the classes of immunity? I said that number one is innate immunity, the one we are born with. Then adaptive immunity that will develop as a result of exposure, as a result of experience. So newborn immunity versus acquired from measles vaccine. So all these are part of the classes of immunity. So just like I said, innate immunity is the first line of defense. And example of this is what we have from the kidney, from skin and mucous membrane. So you just discover we are going to get we are going to do more details. I'm going to teach you more details about all this, but this one is just like just to mention them as passing. So first line defense that we have from the skin, then the mucous membrane, okay, then the internal defense mechanism, which include phagocytes, natural killer cells. So that means innate immune system can be divided into two. Okay, at least you have the first line, which is going to be external. Then another one is internal, which are the phagocytes. Phagocytes are professional. They are professional. Uh, Phago from solid side, that is ability for them to be able to swallow. So that a natural killer cell. We are going to see more of this when we go on, but all these are part of the component of the innate immunity. So an example is a cough reflex preventing pathogen entry. Anytime you just discover that you just start coughing until maybe after some time. So what your body is trying to do is to eliminate, is to remove pathogen from entry. So and it is part of the innate immune mechanism. So adaptive immune mechanism, these are specific immune responses which is due to two different types of cells, which is humoral, that is the one that involves B cell, that is antibody, and cellular, the one that involves T cell. So example is antibody production after hepatitis B vaccine. Okay, so organs of the immune system, the primary organs of the immune system are bone marrows and the thymus. Then the secondaries are the lymph nodes and the spleen. So removal of spleen increases infection. So if as a result of surgery, if you remove the spleen, so it will expose or predispose that person to more infection, to risk of infection, getting infected. Then cells of the immune system, which include lymphocytes, which are B and T cells, phagocytes, which are neutrophils, macrophages, and natural killer cells. So an example of phagocytes are macrophages, which engulf bacteria. Antigen, I told you that they are foreign molecules that provoke an immune response. It must be foreign. Then it must be able to trigger an immunological response. Then types of antigen. It could be complete antigen or it could be actin, that is part of the antigen. So just a smaller part of antigen is being regarded as actin. So and when the whole substance or the whole molecule is acting like antigen. So that is a complete one. Okay. Then antibodies, they are produced by the cell. They are proteinous in nature, and the function in neutralization, they neutralize. Sometimes when they want to fight antigen, they will just neutralize them. And opsonization, it could also be in form of opsonization. Opsonization means that their ability to make the antigen to be more palatable or to be more for them to be able to swallow. They will just coat it with some substances so as to make them to be easy to be swallowed. Okay, we are going to see more of this as we go on in the course, but don't forget that this is just the introduction to immunology. So and that's why we want to just mention all these as a passing statement. Then complement activation. So apart from this, antibodies can also activate complement system. So we will see all this as we go on. Then types of immunity, just like I said, we have active immunity, which is produced by the host, which can come in form of a natural, as a result of natural infection or as a result of a vaccine. So sometimes when your body is able to fight against infection naturally without any foreign help. So that means you have you are active. That is active immunity. And when you your ability to fight against infection is now as a result of vaccine, that is still part of active immunity. But when we talk about passive immunity, that is the one that is uh, vertical transmission. That is a transmission, the one that you are conferred with from your mother, transferred mother to child as a result of serum. So breastfeeding provide passive immunity. Then vaccination, just like I said, process of inducing. You induce, you trigger, you boost ability of uh, ability of your body to be able to fight against the infection. That is a process of inducing immunity artificially. Examples, we have a lot of examples. polio, measles, COVID-19, and so on and so forth. Then eradication of smallpox through global vaccination. Uh, then immune disorders, that is hypersensitivity. So when your immune system overreacts, when your immune system is able to react against itself, that is hyper. Then immune diseases, these are diseases that that is as a result of overreaction to the self. That is inability of the immune system to be able to to differentiate between self and non-self. Then another one is a immunodeficiency. That is HIV/AIDS. That is part of a immune or immunological disorder. And we have a case study of HIV when the HIV will go and attack the CD4 T cells and weaken the immune system, which thereby open doors for opportunistic infection. An example is tuberculosis in HIV person, so HIV patients. So there is an increased ability, or there is an increased chances of getting tuberculosis once the person is already under pressure as a result of HIV infection. So that is people that have immune deficiency, that their immune system is already weakened, so they have increased chances of acquiring tuberculosis. Okay, so and another allergies reaction is a overreaction of immune system to harmless substances like sneezing, swelling around sometimes, and rashes. For example, when you have bee sting allergy leading to anaphylaxis. So we will see all this when we immune system attack own body. Example is type 1 diabetes and multiple sclerosis. So that is an example of autoimmune diseases, and which we are going to also see in the course of this course. Then transplant immunity, that is the study of immune responses to transplanted organs, use of immunosuppressants to prevent rejection. So, and a case study is a heart transplant patient which is on drugs, cyclosporine. Okay, then cancer immunology. So that is immune surveillance against cancer. That is when you become so watchful on your immune system, thereby preventing yourself from developing cancer. So, and it's as a result of development of immunotherapies, that is, ability of you developing drugs that can actually protect the immune system from cancer. Okay, and some of the immunological techniques, laboratory immunological techniques that we would normally use in diagnosis. Number one, ELISA, that is enzyme linked immunosorbent assay. We will see all this when we go on, which operate on detection of antigen against the antibody. Then Western blots, flow cytometry, all this. So a case study of the ELISA is when you use HIV testing using ELISA and Western blots for diagnosis. Then SARS-CoV-2 virus which stimulates the immune response, which as a result of development of messenger RNA vaccine. So an example is what we have seen there. Then immunology and public health. So what are the roles of immunology in controlling epidemiology? So we are going to see this also in the course of going through this course. Then vaccine campaign or vaccination campaign is also very, very important. And what is the future of immunology? Is immunology still going to be relevant, or that immunology is going to be uh, phased out in no time? No, in the future, we want to study immunology for personalized vaccine. That is, there's going to be some vaccine that will be only meant for you and for you only. That is individualization of vaccine therapy or vaccine production. So that is to tell you that a time is coming when it's not going to be community vaccination again. It's just going to be personalized vaccine. So the only thing they will do is just to take your immune system They will take it to the laboratory and they will go and produce vaccine and drugs that will be made for you and for you only. So that is the future of this. Then cancer immunotherapy. That is at a time that will be coming now. That means we'll have a kind of forecast. We will be able to predict when there's going to be onset of cancer. So, and once we are able to predict cancer, uh, we are able to predict cancer epidemics. That means we should be able to, in no time, we should be able to develop uh, vaccine against it or produce drug that will be able to fight it. So then, there is going to be advances in autoimmune diseases treatment. So uh, that is a part of the future of immunology. Then, summarily, don't forget that in this presentation, I told us that immunology is the study of the immune system. Then it can be divided into innate and adaptive immunity, which is very crucial in vaccine, disease prevention, and treatment. So, immunology has actually revolutionized medicine and public health. So, the first discussion, which you should provide answer to in the comment section, is that how can immunology help to prepare for future pandemics? So, the multiple choice question: which of the following is not a component of the immune system? Is it antibodies, bone marrow, neurons, and lymph nodes? So I want the answer. Then, which scientist is known as the father of immunology? Is it Robert Koch, Louis Pasteur, Edward Jenner, or Ellen Mechnikov? Okay. Then essay question. That's you should explain the differences between innate immunity and adaptive immunity. Then you should be able to provide examples of how each of these innate and adaptive immunity, how can they protect the body from infection. So these are questions that you must provide answer to. Don't forget that the first question is going to be on um, discussion. Discuss how can immunology help prepare, to prepare us for the future pandemic. For example, now, like if there's going to be another pandemic like HIV, how can immunology help us to be able to predict that? Then you should provide answer to this. You pick the best option for it. Then quiz two, you also pick the best question for it, and you should be able to also answer this question correctly. So thank you for your attention. Thank you. So I don't know if any one of you has any question. Please, you are free to ask. Are free to ask in the comment section. Okay. Yeah, please, if you are hearing me, say hi. If you are able to hear me, say hi, make comments. Let me see. Say hi. Okay. I will be expecting your. Okay, okay. Let me do Dockers. Thank you. Okay. Yeah, thank you. And can they praise? Okay. Don't forget that yes, the attendant will be auto-generated. Auto-generated, that means you have to have registered. To register is going to take the attendance automatically. Okay. Yeah.